Spirometry is not a passive test. The spirometry maneuver requires maximal effort, the subject's personal best. Filling the lungs to total capacity, then blasting air out past normal exhalation is not a breathing pattern most people usually attempt. It requires a subject to follow directions and expend maximum effort. In order for a subject to complete an acceptable spirometry test, the technician must be thoroughly trained. Technicians should continue to improve their instruction and coaching skills through frequent test quality feedback. A well-trained spirometry technician is like a personal trainer who instructs and motivates the subject to perform their personal best effort. The goal is for the subject to complete at least 3 acceptable breathing maneuvers, and for 2 of those 3 to be consistent or repeatable within a small margin. This video is intended to instruct spirometry technicians in equipment preparation, subject instruction, coaching, correction, and the reporting of accurate results.